So this is my response for week 8 participation. So first, whether or not this is new knowledge or existing knowledge to me, all the topics that are discussed in this in detail this week are new knowledge to me, as been much of the class. It's been very informative to learn about the different types of laws and regulations around substance use and abuse. It's new. It has not been existing knowledge. In terms of discussing any further questions I might have about confidentiality after reviewing the information, the first one I had is, why can't a 14-year-old access medical services without parental consent? Seemed like a weird age to decide what they can access or not in terms of medical services, like being able to go to the hospital and emergency services and things like that. 14 seemed weird. Along with that, what makes a 15-year-old eligible? What is the difference there between those two ages, where a 14-year-old can't but a 15 can't? And in the last question I had is, in this same case, are you able to keep those services a secret from the parent? It seems very difficult to help provide treatment for a minor who might be struggling with substance use disorders without their parents knowing and without getting their parents' consent. Seems like a very difficult thing to do without their help or without them knowing, helping them without knowing. So those are the questions I had. So number one, in regards to how does this law define program? A, it is an entity or individual who is not a general medical care facility. They stand out as providing drug abuse or alcohol diagnoses, and they provide treatment and or treatment referrals. This could look like a drug counselor, a licensed clinical social worker, or someone with a CADC certification. Personally, my supervisor at my practice at Cascadia is CADC certified, so he would fall into this category as first part of program. And then B, the other one is an identified unit within a general medical facility that holds itself out for providing drug and alcohol diagnosis, treatment, or referral. An example of this for me, again, would be my practicum, because we have a specific substance use disorder treatment center inside of Cascadia Behavioral Health. So that'd be that. And then the third one is medical personnel, excuse me, or other staff in general medical care facility whose main job is to provide the diagnoses and also treatment and referral for treatment. And they're identified as such providers. These are similar to the first ones I went over, except they're medical personnel, which could be a doctor, a nurse, people who do intake potentially, or they referred. So for number two, the required elements for filing a written conformed consent, according to CFR Part 2. So first one is the general designation or specific name of the program or person that is permitted to make the disclosure. So John gives Providence. This is all going to be a case example that I wrote. John, for example, gives Providence the permission to make the disclosure. So he's at Providence Medical Center and he gives them permission. Then the second one is the name of the individual or the organization to which the disclosure is to be made. Providence is doing it to Hazleton, so Hazleton and Newburgh. Providence is referring to Hazleton. And the name of the patient is the third, which would okay, I sort of got this mixed up, but initially the first one, John, is the provider who's giving permission to make the disclosure to Hazleton. And yeah, he's the medical service provider. And then number three, the name of the patient is Earl. Earl is referred for alcoholism. So John gives Providence the permission to make the disclosure, and to Hazleton and Newburgh. So the first one is the person who is able to make the disclosure. The second one is where the person who's able is the first one and the place they're at. And the second one is where they go to, and the third one is the name of the patient. And the fourth is the purpose of the disclosure. And this would be to give information about Earl's current alcohol use and abuse. Number five, how much and what kind of information is to be disclosed. John shared he has a family history with alcoholism and that he's been using for 10 years, and he just recently got a DUI. So that'd be how much and what kind of information should be disclosed in this case. Number 6, it requires the signature of the patient, and when required for the patient is a minor, the person above them, but John is 34, so he's able to give his own signature in this case. The date on which the consent is signed, which this one was on September 16th, 2015 in my case study. And then 8 is a statement that consent is subject to revocation at any time unless the program or person, which is to make the disclosure, has already acted in reliance to it. So they've already applied and they've acted on it, then it can't be revoked. And I wrote that John reads the statement and understands that it's subject to revocation at any time, except for if the disclosure has been acted upon. And then 9 is the expiration date. It's the date or condition upon which the consent will expire if not revoked. And this date, event, or condition must be reasonable. And so I made it a year. This will expire within a year from the date on September 16th, 2016. Number 3, what are the exemptions and exceptions to Part 2 regulations? So first off, information can be disclosed without written consent of a patient in moments of audits or evaluations. For example, a yearly audit, medical emergencies, if a patient is currently experiencing an overdose, that would be one of them. For research purposes, I put for maybe a federally mandated research project, that information can be disclosed. And then the second part of that is restrictions of CFR Part 2 do not apply despite the person having substance use disorder if they are in the Department of Veterans Affairs, the Armed Forces, if they are in communication with a Part 2 program and an entity having administrative control over the program, if they're a qualified service organization such as Hazleton, or if there's crimes occurring on Part 2 premises or against personnel of Part 2, such as a stabbing or a burglary, that would definitely fly. And also in times of reported suspected child abuse or neglect. So, for example, John's child has bruises on their face would be one that applied to. So those were the exceptions and exemptions. For number 4, the age of consent that a minor can access outpatient mental health without parental consent or alcohol treatment, including methadone without parental consent, is at age 14 or older. And this can look like seeing a psychiatrist, seeking treatment for drug alcohol abuse. The parents are expected to eventually be involved unless they're refused or have suspected sexual abuse, among other things. But in general, they are expected to be involved at the end of their treatment. How does this differ from services a minor can access at 15 in the state of Oregon? So at 15, like the questions that I brought up initially, minors can access dental and medical services. This is different than age 14 because they can't get it then. And the difference from 14 is at 15, you can get help for injuries, vision, x-ray, emergency room visits, urgent care, any sort of medical reasoning to go, you get it at 15. And if you're in an environment where they're constricting laws, which one should you follow? When privacy laws conflict, you accept the most constructive law. This is straight from, all of this has been from the readings, and this I got from the potential confidentiality toolkit for providers. So accept the most constrictive law. So if there's two conflicting ones, make the one that is most constrictive, so that it keeps the client safe. And overall, the general rule of confidentiality from this week's videos is that you do not disclose. So if when in doubt, do not disclose. So that's the golden rule. If you're confused about it, do not disclose it. So yes, that was my assignment. Thank you.